And as much as we all want it to be done, doctors have said this over and over again. The virus sets the schedule. And THV 11's Ashley Godwin finds out what we need to know about this next wave of cases and how vulnerable populations should be prepared.
I do anticipate that we will have an additional surge.
Since September, Arkansas has seen a decrease in COVID-19 cases, but we started to level out in November. Now we're looking at another increase.
Other states are experiencing it. Europe is experiencing it.
Despite our vaccination efforts, the Delta variant is still spreading.
We do not have enough people in Arkansas who are immune to COVID-19 to prevent additional surges.
But vaccinations have made a huge impact for some of our most vulnerable Arkansans. During the winter of last year, we were in one of the worst surges of the pandemic with no vaccine and a few authorized treatments. The elderly were hit the hardest, especially in nursing homes. But that's also where vaccines made the most drastic difference. At the peak of the winter surge last year, we had 127 nursing home residents die in 1 week. Compare that to just 8 deaths in the summer peak. Clear proof of the vaccine's landslide effectiveness.
We have a different situation than we had in the past.
When we asked Rachel Bunch, the executive director of the Arkansas Healthcare Association, if COVID precautions would stay in place during this next surge, she sent a statement saying, in part, visitation guidelines are regularly reviewed and updated by Centers for Medicare and Medicaid Services, and our facilities monitor and abide by those requirements. But for the rest of the population, where vaccine rates are lower, the Delta variant poses a clear and present danger, especially as it continues to add brand new mutations.
We need to get our vaccination rates up, and for people who've had COVID-19 before, they need to get vaccinated because they could get it again.
In Little Rock, Ashley Godwin, THV 11 News.
Dr. Dillahay points out that right now, when so many people are sick and tired of this pandemic, they're easing up on protective measures because of that, even though that will make the pandemic last longer.